Cholesterol is a waxy, fat-like substance produced by our liver. It's vital for the formation of cell membranes, vitamin D, hormones, and every single organ or human tissue we possess. You might be surprised to learn that cholesterol is actually good for you, even given the fact that so many doctors tell you that your cholesterol levels might be over the limits. But what are some of the symptoms that indicate you have high cholesterol? Obviously, if you have it over the limits, this might not be good for your system. So in today's video, I'll reveal some of the most important ways and symptoms to know if you have high cholesterol to stay healthy and avoid more serious health conditions. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlandivar.com. In this channel, as a conventional doctor, to my patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to see notifications and be the first one to watch new video. If you need all important quality supplements for your disease, visit drlandivar.com and stay till the end of this video when I share extra tips and video links related to this topic. Most people think that cholesterol is always unhealthy. As a matter of fact, it only becomes a problem when cholesterol levels go above normal standards. Now, the worst part about this is that high cholesterol is very hard to notice if you don't know what risk factors are tied to it. If you decide to ignore this health condition, high cholesterol, you're at a great risk of suffering from circulatory problems, heart disease, strokes, and even heart attacks without even having a warning sign. The secret lies in knowing how to recognize the symptoms and risk factors before cholesterol takes control of your body. So in today's video, I'll reveal some of the most important risk factors and symptoms that tell us we might have high cholesterol levels to stay healthy and avoid more serious health conditions. Number 1, being overweight. Having high cholesterol is one of the hardest things to recognize without a blood test. The best way to be sure that high cholesterol does indeed exist in your system is done by looking at blood itself and measuring the amount of cholesterol in circulation. Now, this doesn't mean that we can't relate to conditions like obesity or diabetes when it comes to cholesterol. For most people, being overweight or obese is a very important risk factor for cholesterol. So if you are with a little pounds above your size, I really suggest you take this problem or this health condition into consideration. You might have high cholesterol and you might need to reduce your weight, change your diet, and get some exercise. If you need something natural that can improve the cholesterol you might be having in your system, in circulation, and at the same time all those values to make sure they stay on a normal level, look for On Cardio and Heart Excel from Fineland at drlandivar.com. Number 2, poor circulation. Poor circulation is a lot more common than people think. Very common. This happens, for example, when parts of your body can't get enough blood to function properly. Your feet, your legs, your hands. You might feel that they're numb. There are many symptoms. Now, if you're light-skinned, your legs might get a blue tinge, for example, if you have poor circulation. Poor circulation can also make your skin dry, your nails brittle, or your hair fall out, especially if you have problems with your thyroid, then even more. Now, although all of this is not actually caused by high cholesterol, it's definitely seen frequently in people that have bad circulation. You see, high cholesterol can cause these symptoms to worsen or appear when a plaque is building up in the artery walls and doesn't let blood go to the end where it needs to. Cholesterol can block the flow of blood in your arteries and obviously block even supply to other organs like kidneys or the heart, and then you have problems like a heart attack. So watch out for having poor circulatory symptoms, poor circulation. These symptoms might include cramping, fatigue, pain during physical activities, or even discomfort in your legs or feet. Oh, and by the way, these are the same people who also have a greater risk for suffering from a heart attack due to cholesterol blockage. If you need something natural to improve circulation that can help you at the same time when you exercise or change your lifestyle habits to make sure your body actually stays healthy, look for Vein Flow Thistle Essence, which can actually help you regulate cholesterol levels and improve circulation. Number 3, chest pain. I don't know if you've ever experienced chest pain before. Now, this is the true chest pain I'm talking about. Although chest pain in general can be a respiratory condition, in many occasions it could also be a symptom of atherosclerosis, which is basically the narrowing of your arteries caused by the buildup of plaques. This plaque, which most of the times is seen in people with high cholesterol, doesn't let the arteries receive all the blood they can carry, and in the long run creates a problem for your heart, which actually can show as a chest pain. Now, this can be a chest pain in general, a chest pain that is actually oppressive, not so much as, maybe like a stomach ache. It's not something that can be there for a long period of time. It's actually something that comes and goes very frequently. Now, if you see this symptom, be very careful. You might want to get yourself checked, because that chest pain that comes from time to time is not a good idea to have it hanging around. Check with your doctor, get some blood tests, and see if your cholesterol might not be high. If you need something natural that contains more than 50 fruit and vegetables, vitamins, minerals, probiotics, and enzymes, everything very, very well formulated for you to have all the antioxidants and balances with vitamins and minerals you need, look for Green Shot and Multivitamin from Fineland at drlandivar.com. Number 4, headaches, dizziness, or strokes. If you remember what I told you at the beginning, when cholesterol is very hard to diagnose on an everyday basis, or symptoms in that case, this health condition may remain silent for decades until little then can be done to solve the problem. But if you have symptoms, problems that become an issue for a long period of time, for example, lack of circulation in the brain that can cause headaches, maybe even strokes that you don't actually recognize at the moment, but later on you might want to get yourself checked. Cholesterol blocks the access to oxygen, causing headaches, dizziness, and if nothing is done to reverse it, then later on strokes. A stroke, for example, occurs when the blood vessel is blocked, and obviously blood is not getting to the part of the brain where you need it. This is either blocked or ruptured, and then you have a problem. So be careful with cholesterol. Be careful with the way you feel. You might have symptoms, small symptoms that indicate that your cholesterol levels, dizziness, headaches, whatever, are not in check. If you need something natural that can help you as an anti-inflammatory supplement you can take every day for brain inflammation, obviously making it harder for cholesterol to cause you a problem, look for Kirku Health and Metathyroid or Appleizer from Fineland at drlandivar.com. Kirku Health contains a 95% curcuminoid extract with bioperin and other ingredients specific to improve your health overall. And help out the channel by giving the thumbs up and share with your friends and family. If you have any questions, leave your comments down below and I'll be happy to assist you. If you need quality supplements for your disease or an online appointment, visit drlandivar.com and check out these other videos for stopping infection that might prevent a serious health condition in the future. Thanks for watching, you guys, and I'll see you soon.